Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right, Carol, tell me what's going on with your hip, your performance, your piriformis.
Okay, well I have been diagnosed with a piriformis syndrome on the left.
On the left side.
That has been treated with steroid injections in the piriformis, the MRSA. Most recently, about 2 weeks ago, I had the last injection. I had good relief. Symptoms are aching in the buttock, often down the posterior side of my thigh, and sometimes into my calf, but typically not from the piriformis. The other symptom I have from the piriformis is a burning sensation that travels down my posterior thigh and then all the way onto the sole of my foot.
So he's a physical therapist, so that's why he uses a lot of technical words. So posterior in the back of his thigh and going down to the side or going down to the calf.
Yeah, that's what really, the piriformis doesn't seem to affect the calf. I don't notice that. It's just the burning sensation is in the posterior, the back part of my leg.
So it's in the back of the leg and going down.
And then skips and goes all the way down just to the sole of my foot. It feels like I'm standing on a hot plate.
Okay. When you feel that, do you feel that when you take the first few steps, or just it's random?
It's random, and it's mostly, that symptom seems to come from sitting more than anything.
From sitting.
The other thing that really exacerbates it is standing. Just standing, and not necessarily walking, but standing for a long period of time.
Okay.
Like standing at the sink to do dishes, standing at the sink in the bathroom to shave, or brush my teeth and water pick. Those things really seem to make it exacerbate
the performance.
The piriformis, and oftentimes, as well as the other symptoms.
The piriformis. Okay, so piriformis is the muscle that's attached to here to the other side of the leg. So can you tell me?
Yeah, that is what I'm really here to see you about more than anything. Is that perineal nerve that seems to be inflamed. I'm thinking that it might have some constriction with soft tissue, maybe the fascia around it. And it is the reason I'm most concerned with it is that it is also intermittent. But when it hits, my leg collapses.
Your leg collapses.
My leg
so piriformis, it's actually it's apply the muscles that in this side.
And I'll just and that, which is the primary reason I use.
You use the cane. How long have you been using the cane?
Couple of years.
Okay. How long the piriformis issue and the performance?
About 3 years.
3 years.
Yeah, about 3 years.
About 3 years, you have those two issues.
Yes.
Can you just quickly go over what kind of treatment you have for the piriformis and the piriformis?
The piriformis, I do piriformis stretches. I only really do one type, which is most easy for me, which is lying supine.
I will be very easy with that actually.
I may stretch it too much.
Because if you overstretch, actually, you can cause micro tear in the muscle. And study shows actually stretches cause inflammation. So if you cause inflammation, you're going to build a new scar tissue. It's a vicious cycle. Right. So I'm not really crazy with the stretch. It's better to do soft foam roller on it. I will avoid the stretch because I had patient actually, they had minor piriformis syndrome. They overstretch because they cause micro tear, cause scar tissue.
Right.
It was major.
Well, that could be. I try, I don't go into a heavy pain when I'm stretching.
Yeah.
I just will bring it up.
I will do range of motion.
Do I do, or you?
No, I want you to do range of motion.
Sure, and I do that. So I put it into external rotation and flexion. So
just go back and forth, don't hold it.
Okay.
Yeah.
Okay.
What else?
The other treatment has been steroid injections. Steroid injections. I've had 3 of those over the course of the last year and a half. Maybe 4 of those because I've seen 2 different doctors over the last couple of years. And as I said, in February of this year, I had an injection of the extensor digitorum, which runs right along the superficial perineal nerve. So I had injections, 5 of them, following the course of it. Following the course of it, with excellent relief. For a week, I didn't have any discomfort in that lower leg.
But your pain came back?
They came back.
Okay, so how much pain here from 0 to 10 and there from 0 to 10?
3 or 4 most of the time. When this hits, it's a 7 or an 8. I mean,
Okay.
when it sparks,
And your knee buckles when that's happening?
my knee buckles, it just collapses.
It collapses,
Yeah.
okay.
And it's not like it doesn't as much feel like the pain as it does a kind of a neurological reflex. And maybe from my spinal cord injury, because I have a normal spasticity from my spinal cord
that's
injury.
a risk factor for having something like that. Because it's not very common with the piriformis injury that you will have this.
Yeah.
So if we're gonna do now something that to aggravate your symptoms, is it walking, standing, stairs? What we can do to relieve
I can
symptoms?
do some knee bends if I go down too far.
Squatting?
Also, if I flex too far, I can really exacerbate that pain.
Flex. So we're gonna take your range of motion for flexion.
Okay.
So we'll use it before and after to see how far you can flex. So that's one thing. What other thing? Do you use the steps?
Descending stairs
Okay.
has an impact on it. I mean that if I leave this leg up, if I do an eccentric and a lengthening contraction of it, not as much for going upstairs with it.
When you step down.
When I step down.
Okay, so that's what we're gonna do actually. I will measure your knee, okay? And that's why we are here.
And then if I step down with my left, it's not too bad. It's stepping down with my right there. It just kind of lets go.
How much pain?
2 or 3. Not horrible pain. It just lets go.
Do it again.
Okay.
1 second. Look, you're gonna face the camera.
Okay.
Your muscle are very weak, man. So what's happened here? You're not able?
No, I was just feeling, seeing if I could cause the pain.
Oh, okay.
Like the relief pain.
Okay.
Yeah, see where, could you feel where how just getting out?
Yeah. You didn't have a good control over it.
No.
Yeah, no. How much is now?
And that's because of my right side.
Yeah.
My proprioception is affected
From the spinal
from my
cord.
spinal cord injury.
Yeah.
So when I can't, right
Yeah.
single leg stairs on the right leg.
Okay, so what else we can do to test it? Flexion? Reflection?
Yeah.
Okay.
That's something that we can.
Yeah. So now we want to take the range of motion, and I want you to stop when you feel pain.
Okay.
Okay, and give me a number from 0 to 10 how much pain. So this way we know how you respond to the treatment. Okay.
Okay.
So let's actually extend. Push me down.
That's it.
Are you serious?
That's it.
Okay, so his minus 15 extension, can you see that? This is 15. So he's missing 15 degrees for his knee extension, okay? Let's do the flexion. And remember this numbers, okay?
Right there, it starts to...
Okay.
I start to feel...
This is a...
twinge of pain, maybe a 2.
Okay. Okay, so you're pushing it now, okay? How much is now?
That's about it.
How much pain? He's a
2.
115
2 or
here.
3.
115 for knee flexion. 115 and 15, okay? Remember this number. 2, 3, and where do you feel it?
Along the outside of my calf
Okay.
and a little bit in my quad.
Because of your background, I'm just going to explain a couple of things, okay?
Okay.
So, I'm going to work on the superficial fascia, okay?
Okay.
So let me know if you feel any pain with that. I will take that. Thank you. You feel the tightness here in your fascia?
I do.
Okay, so I'm going to release it now. How does it feel now? You feel the mobility?
I maybe a little bit.
Okay, feel the tightness here. This is not going much, over much. Gonna release it. Okay. Feel the movement now?
Mm-hmm.
Okay.
Yeah.
So it's most of your symptoms is lateral, yeah?
Yeah, more lateral. You were just in a good spot over a little more proximally.
In here?
Yeah.
It's right in here.
Yeah, right in there.
Okay. Your fascials are inside here. You had any injury here?
No. When I was 14, I dislocated my kneecap.
Which one? This one?
Yeah.
No surgery.
No surgery. They just popped it back on, put an ace bandage on it.
Mm-hmm. You're gonna work on the deep fascia now, okay?
Okay.
Feel that's, I think that's a fibrosis too. You feel that?
I do feel that, and that's something that I've always
Mm-hmm.
tried to point out to the doctors.
Mm-hmm. But, well, medical doctors will not gonna release the scar tissue or
That
the
is-
fascia restriction.
Joseph, you're right on it there.
Well, they don't have a training and
That is a-
they
that
don't have
is-
time to do that
Yeah,
actually.
that is way right where it's at.
Make sure it's not painful, okay?
Yeah, it's uncomfortable. It's not,
There is fine line between actually causing release and actually causing scar tissue or
Right.
tightness. If you feel pain, we actually causing trauma to the healthy tissue and that's
Sure.
causing inflammation. That's why I want to make sure you're not really experiencing pain. If you feel pressure, that's fine.
I feel a little right there.
Pain?
Yes.
Okay. All right. Yeah. Take it with you. So it stems from this point?
Yeah, it seems like it. It
Okay.
and goes distally from there.
Yeah, so we find the spot. Okay. So I'm gonna work actually on the fibrosis, breaking the scar tissue, okay?
Okay.
You're gonna feel cold. You did not have PT, you just did it on your own?
Yes, I have done everything on my. I had PT following low back surgery. I had an L4, L5
Mm-hmm.
synovial cyst removed from the facet joint. I had some PT there, and I just felt that they were not very good.
Oh, okay. Well, you
I felt
you
that
can do it by yourself if it's not soft
Exactly.
tissue. You don't need to actually go to someone show you how to stretch up some
Absolutely.
strength. It's not really rocket science.
Yes.
You know, if you don't do the soft tissue, I'm like, you can do it by yourself. You feel this scar tissue here?
I do. I felt, that's
You feel this one?
man. You're
I feel it.
you're moving right along where
Yeah.
you're the first person that's been able to
Mm-hmm.
to actually do something with where it's been hurting. I didn't realize how much.
You hear that sound?
Yeah,
That's a scar tissue.
that is.
Do you want to feel it with the tool?
Yeah.
You can feel it in yourself. Yeah. You just go. You feel the
Oh
bump?
yeah.
And you hear the sound?
Uh-huh.
Okay, compare it to this. Feel how nice and
It's
smooth?
really nice and smooth.
Let's go back to here.
That's
Feel
insane.
it. See how easy it is with the tool?
Uh-huh.
And you really don't need to work hard with this
Yeah.
tool to really break
That's
it.
just insane.
Yeah. So you can feel it a little bit with the palpation. Sometimes it's easier to feel it with the tool.
You're gonna get a little more
Get
vibration, sort of.
more
out.
vibration, feedback,
Uh-huh.
and of course patient will feel, you feel the bump, you
Right.
feel it as a patient. And here, actually, we can hear the sound.
That's insane.
Can you hear it? Get closer. It's not his ankle talking, okay?
I didn't realize how much discomfort I had down there.
Yeah, how much from 0 to 10? Make sure it's not
While
painful.
you're doing that right now, I'm getting maybe a 3.
Make sure you tell
2 or
me.
3.
Okay.
Yeah. I mean, it's
Everyone
not.
causes a discomfort.
It's not like pain that I'm going at all. I mean, it's
Yeah.
nowhere near that. It's just
Make sure
a
it's
little
not painful.
discomfort.
Okay. So you have really a lot of fibrosis in this area. Make sure it's not too much here. Okay, now actually I'm gonna work. Is it okay to pull your shirt
Oh yeah.
up a little bit?
Sure, absolutely.
I'm gonna work on your RT band. Do we have a pillow for you?
Yeah, that's
Just
perfect.
make sure. Okay, so I'm gonna work on your RT band. See how much is scar tissue. So we have ligament discrepancy, yeah?
Yes.
Want to make sure you wear a heel lift, because you're limping. You feel that?
I do. I can
Okay.
It's just, it's
You feel it?
it's just kind of rattly.
Yes, it's like a washboard.
It is.
It's all a lot of fibrosis. Feel that? And that's what we'll pull on your knee and we'll stretch a little your piriformis muscles and nerve. Is that too much?
No, not at all. That's not painful at all. My son, when he'll come over, will sometimes massage me, and I'll feel the discomfort, the tightness in that.
Make sure he's gentle, because
Yeah.
when you feel discomfort, that causes micro trauma to the
Gotcha.
healthy tissue, and you start inflammation again. If you start
Oh.
inflammation, can you guarantee that in the proliferation you will have less scar than the old scar?
Right.
And that's a common misperception with a lot of, especially in PT and chiropractors, they teach in a lot of classes that, you're going to feel pain because we want to cause micro trauma to the area to stimulate the healing cycle.
Right. I
Like,
understand that.
you're causing micro trauma,
And you're causing more scarring.
more scarring. So it's actually similar to like, you go into a healthcare practitioner, you have cut and you have pain because of that cut. Let me give you another cut so you don't feel the pain of the old cut. And actually the new cut gonna heal the old cut pain. I'm like,
That doesn't make sense.
that doesn't make any sense. So actually causing micro trauma you're causing. And that's what they teach it in a lot of classes with metal tools. They say, you want to cause petechiae. Petechiae was misperceived before. It was claiming that that's breaking the fibrosis. But petechiae actually, after doing a lot of studies, it's actually causing internal bleeding, causing trauma. So you're causing micro trauma, which is stimulating
Inflammation and scarring.
and scarring. So you're actually going back and forth again for the healing cycle. In the healing cycle, you see how it's starting to be smoother now.
Yeah, much smoother. And
Yeah.
I've always known my TFL was real tight, but
Yeah.
actually on both sides.
Yeah. Okay. So I will have you actually lie on your side because I want to get to your calf
Okay.
and your hamstring.
Yes.
Okay. There you go.
Thank you.
Okay. Okay, so I want to get, you can put both knees on the top of each other, just right here. So I want to get to your calf and your hamstring. Okay. Hear that? Do you hear that?
I did. My God.
Come closer. And even in his calf here. You see how it's easy to hear the scar tissue? Like the fibrosis on around the bone area. And you can see here a little bit redness here. A little bit here. Okay, let's see. In here. Your hamstring is not bad actually. It's not bad. Okay, so your range of motion was minus 15 and flexion was 115, okay? So let's actually lie in your back and we'll measure it.
Measure it again.
Yeah. So how long have you been having this restriction?
It's gotten progressively worse
Okay. So it was minus...
over the last year or so in this knee.
Okay. It was minus 15 for extension. Let's see how much it is now. Okay, so now it is minus 10. You see that? Can you see the 10? Okay. Minus, sorry, here you go. Perfect, here is like minus 10. Okay, let's bend. That was minus 15. Oh, not minus, that was 115. Guess what?
125.
130.
130.
Yeah,
Awesome.
130. So you gain 15 degrees.
That was probably just
Flexion.
loosening up the quad a little bit too.
Yeah, well, you have to do the whole thing,
Yeah,
you know.
exactly.
Yeah, because everything is connected. It just does not make sense. I was just working here.
I had one osteopath that thought I needed a knee replacement.
Well, you get 15 degrees.
I have no knee pain. I said, I have no
that's
knee pain. She said, yeah, but you've got some osteoarthritis in there. I said,
That doesn't mean you need
Exactly,
justification
that
for
doesn't mean-
surgery.
that
Even the
doesn't
study
mean-
showed that.
exactly, number one indicator for surgery is pain in the joint.
Yeah, because the study shows like people have bone and bone and they don't have.
Exactly, I have no discomfort in
As
the
a
joint.
surgeon,
Yeah.
it's a good business. Sit up for me. Okay, so gain 15-degree flexion. So we're gonna do the same thing, actually, stepping down,
Okay.
and we're gonna see the quality, and you tell me the pain. Okay.
Okay. A little bit better. I've got a little twinge of it there.
Mm-hmm.
Whoops.
Mm-hmm.
A little bit better.
0 to 10.
2.
Okay, where do you feel it?
Same type of spot.
Okay.
Right here.
Okay, because you have a back issue. It's okay to work on your back.
Yeah, absolutely.
Okay, so it's actually facing the wall,
Okay.
lying your side.
Okay.
Okay. So you had fusion, you said in the back?
No, I had it. Well, in cervical.
Cervical, but
Yeah, no, I just had a.
because
a
you
syn-
have.
I had a cyst removed, a synovial cyst, in the L4, L5 facet joint.
Okay.
Microsurgery. Can we
Okay.
take my shirt off?
You can now we'll put it up like this. Okay. Do you know why I'm working on your back?
No, probably not.
Okay, think about the superficial fascia layer, where it's attached, where it's covered.
It's going to cover your muscles.
It's covered the entire body. There is no
Oh,
beginning.
yeah,
There is no beginning. There is no end. It's
Yeah,
a continuous
fascia is-
system.
Uh-huh.
Okay, so if you have a restriction in one end of the system, is that going to make cause tension in the whole system or other end?
Probably going to impact it all.
Yeah. So I just want to get there, and especially your apparatic fascia in the back, and I want to see how as that goes. Let me know what other surgery you have or trauma, so we can check that. Can you loosen up this a little bit? And we'll put a towel here. Okay. This is the side, yeah?
Yeah.
Okay. Yeah, this is what's overlooked everywhere, the effect of the superficial fascia restrictions. That it actually can. So when you have tightness in the superficial fascia, think about this way. You have one chain, okay? And if you have a tension in one end of the chain, you usually feel pain. There's 3 options for the pain. First option could be the location of the tension. Second option is your weakest link in the chain that compensated for the tension. Third option is actually could be both locations. And that's overlooked on treating the fascia layer. And you have a scar tissue here. You have a back issue?
I get, if I stand for a long time, I'll get low back pain.
Mm-hmm. So I see scar here.
Yeah, that's where I had the synovial cyst removed.
Okay. Boy, how you had this?
Probably from, being off kilter for so many years. I don't know why. I've been fortunate. It hasn't grown back.
Yeah.
The last MRI I had was a year ago, not less than that, 7 months ago, and I had the surgery 5 years ago. So,
Yeah. You feel that scar tissue here?
Yeah, I sure do.
Yeah, it's really good. Yeah, so that's good. I'm glad you feel better with that. Yeah, keep follow up with that. Don't pay attention. I'm getting lotion everywhere. Okay, it's on the floor, on the table, my clothes. That's usually the patient's fault. It's not the therapist. Hear that?
I can hear that all the way vibrating.
Yeah, you see? That's I changed the design a lot for this tool, and I changed the material until able to get really good feel and sound from it. Feel that? Yeah. There you go. I'm not surprised with your leg length discrepancy. You will have a lot of scar in every, in several areas. So you can tie your pants and we'll give it a try again. So 130. Yeah. Hold your hand here. You're testing that.
I was testing.
Yeah, he's testing. He's not.
I was seeing how it was working.
Yeah, you getting the legs? Okay.
A lot better.
0 to 10.
A 1, and I feel, and I can. It makes me feel a little bit stronger. It makes me feel a little bit stronger as well.
The camera. Okay. Hold your hand here. Okay. He's doing that to test it. You look more stable now. Yeah, that's good.
Well,
we need to do a lot of strengths with you.
I'm real stable on my left side.
I need to hold.
Yeah, my right side is where I'm pretty unstable.
Yeah.
But I mean, in that mid-range,
he's doing it.
My mid-range, I'm pretty good. It's when I get down to there. That's where I kind of get that pain here and right here.
From 0 to 10?
And a 3 or 4. I mean, it's not like a horrible.
You feel it now, or
no pain now. Just
why are we doing now? Like after the treatment, how much do you feel?
Right now, no pain.
After we did this.
I don't feel anything right now.
Okay, let's do it down one more time.
Okay.
So it was 3 or 4 before we started. Now.
Yeah, a little bit.
0 to 10?
It's probably a 2 or 3.
Okay.
Coming down.
Okay. What other motion? Let's do the bending again, like this, and tell me how that feels.
As I do it more, it's less discomfort.
Because it starts to loosen up.
It's loosening up.
Yeah. We need to do a lot of strengths.
Yeah.
Your quads, we need to strengthen that a lot.
Yeah. I haven't wanted to exacerbate it, so one of the exercises I do is in the pool. My pool's probably 4 feet on the edges, so I can hold the side and I can.
What's aggravated?
And that doesn't aggravate it. If I try to do it standing on a counter at home, really gets it. But by being in the pool,
because it takes some. Let's do that exercise now.
I'm sorry?
Let's do that exercise now.
Which one?
That aggravated. Let's just say it's aggravated in the pool.
Yeah.
And tell me how much when it's aggravated out of the pool.
I'll tell you that part now.
How much it used to be before when that's aggravated.
Oh, this is much better.
0 to 10?
No pain.
How much it used to be before we're doing this?
It would go to a 3 or 4 sometimes.
Yeah. How's that?
Pretty good.
We need to work on your full metal, but your knees collapsing a little bit. We need to have your legs should be shoulder width. Yeah, and we need to work on your adductors and abductors. That's good. How's that? Are you trying to show off now?
I'm just seeing what I can do.
I'm glad. I'm just joking.
I'm seeing how well it works.
Yeah, how is
it
that?
feels good to be able to do a little bit.
Yeah. So you are a physical therapist. Can you tell me, like being physical therapist and being a patient at the same time and receiving ASTR treatment, what's your thought about the treatment itself?
For a first treatment, I'm actually quite impressed. As I said, I heard about you through communication you had sent to me being a physical therapist. Being retired, I wasn't really interested in taking the courses, but having the problems I had, I've tried so many other things, and they've been ineffective. I've tried modalities, I've tried ultrasound, I've tried E-stim, without any relief. And after this one treatment, it's better than everything else combined.
Beautiful, that's good, yeah.
So I'm impressed.
Yeah, thank you so much. Thank you, I appreciate it. Thank you. I'm glad you're feeling better.
Yeah, sure.
Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class.
There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.